Fit and Healthy Today show. Today our topic matter of discussion is on sinusitis. And it seems like we have an epidemic of this going around viral-wise. And so I thought I'd better address it, the symptoms, the causes, the diet, and then some of the supplements that can be utilized. Since most of this is caused by viral or fungal, very rarely bacterial, antibiotics are virtually useless in these particular incidences. There's a few exceptions, but most of the time they're pretty useless. The definition of it's an inflammation of the nasal cavities, often leading to chronic infections and an increased amount of mucus. And the mucus tends to be a little bit thicker and gnawing, continually dripping on the back of the throat, making a person feel like they have a sore throat all the time. You oftentimes get pressure and pain around the cheeks and behind the eyes. The nasal passages feel clogged, or they'll run and they get clogged. And the mucus oftentimes, when it does, then all of a sudden change from that kind of gooky looking stuff to the yellow or the green. That means most likely that we've got a viral or a fungal infection setting in. When there's an infection, you get a weird taste and a weird smell. You get fatigued, and oftentimes you can get kind of a slight fever and maybe be a little bit off balance, particularly if this starts to enter into the ear passages, and then you get dizzy and you get clogged and you feel lousy. The causes. Now, most people think, okay, I get a virus, I got a cold, there's my cause. Now, you would be surprised in our communities here in Santa Maria and Lompoc, Buellton, how many people have a chronic problem all of the time in this area. They always have sinus problems. And they come in and they say, what can I do about this? I think it's allergies. My doctor's diagnosed it as allergies. It's usually, in my assessment, much more than just allergies. And here's a slew load of causes that most likely address it. Number one, I don't have listed on here, is people don't drink water. So their mucus and the mucous membranes, anything that comes out of there is kind of a thick, sludgy, slimy type of thing. And you can't properly blow your nose and things can't drain. The diets are too acidic, causing increased inflammation. There's a lot of eggs and milk products, a lot of what we call starchy carbohydrates, and the complete lack of vegetables. So the diet gets very, very acidic, and you get very chronically inflamed. They have actually done studies where they've taken people and literally put them on an all-alkali plant-based proteins and all vegetable diet, and literally within 3 to 4 days, all the symptoms in a chronic situation would clear up. Now, we're not talking to the point of infection, but the chronic sinusitis with the other descriptions. When you don't eliminate, or the liver gets congested, in other words, you're toxic. And when you get toxic, your body's going to look for ways to detox, and it's going to come through your skin, it's going to come through your nasal passages, because if you can't poop it out or pee it out, oh boy, it'll look for other alternatives, and your nasal passages can be one of those. The immune system is reacting oftentimes to fungal and chronic fungal back in here. People are eating so much sugar and junk that they'll get chronic fungal infections in the back of their nasal passages, and it just sits there and it irritates and irritates and irritates, and it never turns green or yellow, it just gets irritated. And if you add a deviated septum or other mechanical issues regarding the nasal passages, you'll have a chronic issue where the fungal and the bacterial or the viral can kind of get in there, and it just stays always agitated. Then when people are using things like Flonase or steroidal creams, then the membranes get even thinner and then even more sensitive. So treating this early by alkaline your diet as much as you can, increasing more raw vegetables, and I mean seriously raw organic vegetables as much as you possibly can. Most people are lucky if they do 1 or 2 servings of potatoes a day, not even raw vegetables. So now, when a person is extremely they're getting no sleep, they're under a lot of stress, what we call adrenal exhaustion as well, it can make the body very, very acidic, and then everything kind of breaks down, including the body's ability to drain. Now, if you're not getting movement, if you're not exercising and motion and getting the lymphatic system to move along, you're not detoxing the body, and you're poorly eliminating. Once again, the nasal passages are going to look for the best way to possibly eliminate as much toxins as it possibly can through the skin and the nasal passages. So therefore, that being the case, diet is very paramount, and alkalining the diet full of fruits and vegetables, primarily plant-based proteins. I mean, chicken and fish, I think, particularly if you can do organic forms that are chemical-free as much, because a lot of these chemicals are extremely acidic. And when you're eating acidity or acidic, you're going to have more issues with allergies and mucus and chronic sinusitis. You got to avoid, and I know this is a tough one for most people, avoid all sugar, flours, chocolate, eggs, starches, fried and processed foods, because those fried kind of foods, and the meat fats themselves as well too, especially if they're fried and the fat isn't cooked out, produce inflammatory fats that are going to keep you chronically inflamed. Beef is pretty acidic, but the most is sugar, white flour, pasta, starches. Most of those things are going to be very high on the acidity scale, and it's going to make for thicker mucus that will not drain out of the body. So when you can, please, start the breakfast, a nice little bowl of oatmeal, a piece of fruit, a protein shake, or some source of plant-based protein. Beans, you can do a little bit of eggs, but getting that fruit and those vegetables in at every meal. And then something I didn't write on here is please also increase what are called good fats. Those good fats such as nuts, avocados, and I'm talking walnuts, almonds, pecans, things that now mind you, nuts you're not allergic to, because obviously allergies can also trigger this chronic sinusitis symptoms and chronic problem as well too. So those good fats help reduce inflammation as well. You always kind of want to have more good fats in your diet than bad fats, and that way you'll decrease inflammatory responses and you'll better deal with everything in the body without pain. I'd like to review some of the supplements that are utilized that can be very, very helpful in reduction of inflammation and then treatment when it does get to that infection stage. Now for me, in my younger years, I used to have chronic inflammation and asthma and bronchitis all of the time. And I was guilty of some of the other issues as far as having a lot of starchy carbs and that type of thing in my diet. But I have to say I was on antibiotics continually, and it never resolved the problem. On antibiotics without doing any probiotics, and my immune system stayed compromised, and I had chronic problems all the time. Every couple of months I would end up with a sinus infection. So what we try to do before it reaches that stage is we obviously correct the diet immediately with whatever you're doing and get on a good, believe it or not, I read a study on chicken soup and vegetables, and it was one of the best things in the world, honest to gosh, for sinusitis. We don't know exactly why. Chicken soup for colds and sinus problems seem to really help in combination with the vegetables. So, N-acetylcysteine, that is an amino acid that's a really strong antioxidant for the liver, the lungs. It also can thin mucus in the nasal passages. Anywhere from 2 500 milligram capsules 3 times a day. I'm sorry, 1 500 milligram capsule 2 to 3 times a day. Bromelain. Bromelain's an anti-inflammatory. It comes from pineapple, reduces inflammation, and we actually have products at the store that one called Bromelain Sinuses. It is a combination of bromelain, vitamin C, and bioflavonoids, along with some quercetin, which is great for allergies. It's also a bioflavonoid. And that can help with some of the inflammatory responses lending to sinusitis. Homeopathic remedies, and I actually, most of the time you'll see that I'll have homeopathic remedies here at the bottom. Not this time. I have to say they actually work very, very, very well. And you can find different formulas for sinus issues and for allergies. And I would say they're anywhere from 50 to 100% effective for helping with this type of thing before it reaches infection stage. There's a lot of them out there. There's a lot of different formulas. You can actually research yourself, or there are homeopathic doctors. We don't have any in Lompoc and or Buellton or out in Santa Maria. But Santa Barbara and San Luis Obispo, you could track one down and hopefully maybe get some homeopathic remedies if you want your own special formula designed for yourself. But I probably have, for allergies and that type of thing, probably, oh my God, 15 or 20 different homeopathics that work for sinus issues, sinus pressure, sinus pain, Now, when we're talking about infection, which lately this winter season I'm seeing tons of sinus infections, like they're going out of style, and none of the antibiotics are working. My customers, another one came in today, she's been on 2 gamuts of antibiotics. She's having tons of bowel issues now because the antibiotics were taken without probiotics. Sinus infection is still there. So she has a viral or some type of fungal sinus infection. So grapefruit seed extract, 2 sprays in each nostril 3 to 4 times a day, really helps for an acute situation. To get rid of that infection, kill it, you lean your head back, a couple of sprays, let it get back there. And if you're trying to prevent, I have some people that use neti pots, or they'll do their nasal spray once or twice a day if they seem to have a chronic issue all the time with that mucus sinusitis. Colloidal silver, extremely antibacterial, it's what I call antimicrobial for viral, fungal, and bacterial infections. There are nasal sprays, or you can mix up your own in your neti pot. And these are little pots, I know Dr. Oz talks a lot about them, that you can pour and use like saline or salt solutions that can help reduce inflammation in the nasal passages. But you can throw in some colloidal silver 3 to 4 times a day, and that will also kill the infection. Turmeric. One of the best anti-inflammatories around, and it's turmeric extract or curcumin, also known as curcumin. Anywhere right about 500 milligrams 3 times a day, always with food, breakfast, lunch, and dinner. Reduction of inflammation and sinus pain, and there are double-blind placebo studies on that for chronic sinusitis and sinus inflammatory issues and pain. Vitamin A. Now, in this country, a lot of people are vitamin A deficient, and I know whenever we talk about vitamin A, the doctors all seem to go, oh my God, an overdose of vitamin A, you can end up with liver problems. That would take you years of high dosages of vitamin A in order for that to build and store around the liver. So when someone has a chronic or acute problem, oftentimes using 25,000, I use 3 to 6 times a day for acute, and then maybe 1 a day for something that's just a chronic issue, can help the body better fight infection. We use this for a lot of different things, and in 4 countries, before they give babies vaccines, they give them a high dose of vitamin A to help their body better deal with handling the vaccine. In this particular case, it helps the body better fight infection. Cod liver oil, fish oil, or we had mentioned the nuts earlier before. I'm allergic to most of the nuts, so for me, this is a much better option, and believe you me, there's some out there that I tasted this weekend at a trade show that my husband and I went to that taste like candy. So these are options if you have chronic inflammatory issues. Taking a tablespoon of fish oil a day, also very great for the brain and inflammation in the joints and other places in the body. But it can really help reduce the inflammatory reaction and response in the sinus membranes. Now, remember I talked about how a lot of sinusitis is due to toxins or toxic people or toxic types of syndromes that people don't eliminate very well? Well, there are bowel and organ cleanses that I think should be looked at when a person is having chronic issues like this. And what they do is they detoxify the body. Now, besides these kits, there's other things to detox with, and that's for a whole nother type of show. But seriously, getting the diet in order, detoxing with all those good wholesome vegetables, maybe doing a bowel and organ cleanse. If you're having a chronic problem all the time, you better be looking at, because chronic problems all the time can lend themselves to a turn-on of autoimmune issues. Yeah, autoimmune, and you do not want to have autoimmune problems brought on by having your immune system chronically engaged, and then it all of a sudden can't identify a friend from a foe. So you have options here, diet changes that we discussed on the back. Hopefully that helps. Any questions, you can always grab these flyers at our vitamin and herb stores. We'll be moving next to the fitness portion of our show. Thank you very much.
Hi,
Hi, welcome to the fitness portion of our show. And today I'm going to show you a core exercise that can be done by anybody at their home. And I'm going to show you the basic move, and then I'm going to show you the more advanced move. Now basically you're going to want to get on the floor, hopefully in an area maybe carpeted that's a little bit softer on the knees. And what you're going to do is you're going to get almost like into a push-up position, and you're going to get down on your elbows, or actually on your forearms, and you're going to keep your back and everything perfectly aligned and straight, and you're going to hold your muscles very tight. Now if you can see, you probably can't see my abs engaged in this, but you can definitely see that my arms are engaged and my shoulders are engaged. Now if I want to make this more advanced, I get into a push-up mode, and as you probably noticed, my breath all of a sudden changed because I had to hold my back muscles in, my ab muscles in, my quads are engaged, my hamstrings, my calves, just about every muscle in my body is engaged in this particular exercise. And what you do is you do sets where you hold it for about 15 minutes to 30 seconds, release, and then engage again. And what that does is that'll help build up some good core body strength. And now mind you, if you have lower back problems, you have to be mindful, and you probably want to do the simple portion of this. But if you want to go for broke, give this a shot and see how long you can hold it. Next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
Thank you for that intro. Absolutely. And now the first title comes up with something called colostrum. Now, if you remember about 15, 20 years ago, they told us that colostrum did not work in an adult system at all. This was broken down by stomach acids, too large a particle, whatever. But now today, after science revealed, colostrum they're looking at as a tool to help benefit our athletes during the Olympics. Why? Well, unusually, this is again printed in the American Journal of Physiology and Gastrointestinal and Liver Physiology, and this is just recent. What they discovered is this: when athletes run at about 80% of capacity, they discovered that what ends up happening is gut permeability increases, meaning the body tends to let toxins from the gut leak into the bloodstream, which can lead to heat stroke and other ailments such as that. How much is the gut permeability increase, or turn to what's called leaky gut, which is very common among runners? 250%. And they said the temperature also rises in the gut by an additional 2 degrees, which is the reason for the gut permeability. But when they gave a group and let them drink dairy colostrum for 2 weeks before the trial, the rise in gut leakiness was reduced by about 80%, despite the exact same effort in the exact same temperature. And they said, quote, "Gut disorders induced by exercise are common in runners. The body's response to increased permeability is clear, and gut contents giving rise to symptoms such as diarrhea to avoid toxins from gut organisms entering the bloodstream. And these, they say, can lead to heat stroke, which can result in damage to the internal organs." They found out also that the death rate of gut cells was increased at that higher temperature, just the 2 degrees. But when colostrum was added to a culture medium, the rise in cell death was reduced by 2/3. And they found out this in reduction, or I should say increase in heat tolerability, the reduction in toxins in athletes' bloodstream could be a huge benefit, not only to our athletes in the 2012 Olympics, which they're researching this for, but also anybody in high heat situations, including military personnel and the like. Really interesting in colostrum. And now back to zinc. Even though zinc has got a bad rap in various studies recently, the Cochrane Review, or the Cochrane Library, recently did a large review or meta-analysis of about 15 trials involving 1,680 people. What they discovered is simply this: when zinc was taken, at 7 days, more of the patients who took zinc had cleared the symptoms compared to those who had placebos. We're talking a common cold. Children who took zinc syrup or lozenges for 5 months or longer caught fewer colds, took less time off from school. Zinc also reduced the antibiotic use in children, which is important because overuse had implications for antibiotic resistance. But however, keep in mind, zinc was just looked at review in healthy people. Yet, zinc out of 15 trials was determined to actually reduce the length of time of a virus-induced or any viral-induced cold, which all of them are. Real interesting. So if you want to keep your children from getting a lot of cold, things along those lines, zinc is not a bad option to include in their diet, at least making sure they're getting the basic RDA. And don't look towards your box cereal with 3 grams of fiber for their zinc intake. Now, those who are taking blood pressure medications and trying to lose weight. In particular, this is printed in the International Journal of Obesity, February 9th edition online. In particular, beta blockers, which can include atenolol, otherwise known as Tenormin, metoprolol, Lopressor, Toprol XL, or newer versions like Cardiolog or Coreg. Well, you're going to add the pounds on. On average, people that took these beta blockers were 11 to 37 pounds heavier than the cohorts taking other blood pressure medications. Interesting enough, what they discovered was this. Well, obviously, it also reduced your desired exercise too. But that wasn't the kicker, not the fact that they're trying to tranquilize you into a lower blood pressure. What they found out, and I'm going to quote this because it's easier. They found that after a meal, the beta blocker users burned roughly 30 to 50% fewer calories in fat from their meal. Yeah, that's correct. You burned 30 to 50% less calories from your meal than people taking other forms of medication in your own group. Meaning, your meal may be 1,000 calories. Your friend's meal may be 1,000 calories. But thanks to the beta blocker that you're taking, that 1,000 calorie meal that you're taking is actually equivalent to 2,000 calories. Because the beta blockers are reducing your ability to actually burn calories from your food, allowing you to pack on those pounds, increasing your blood pressure, increasing your likelihood you're going to get diabetes later on, and a whole other slew of obesity-related epidemic problems. If you're on a blood pressure medication like this, really talk to your doctor. There's better options out there. This is just plain, really just kind of stupid. All right, now we talk about a little bit of manipulation in the market. Let's talk about drugs for preemies, in particular one called progestin, which usually was a very viable option. It's actually promoted by the March of Dimes and other issues in regards to preventing preemie births. The injections of this drug normally came about $10 to $20. It was actually made in about any compound pharmacy until just a few weeks ago. Well, I guess the new strategy is when you can't develop a better drug, find a drug on the market and make a monopoly over it. Well, thanks to KV Pharmaceuticals, also known as TheraRx, they basically took that progestin drug designed for preemies, to prevent preemie births, called Makena, and basically got approval by the FDA, called orphan drug status, to be the exclusive distributor of this medication, meaning no longer $10 or $20 per injection to help prevent people from having premature babies. No. Your new price, thanks to the March of Dimes, and thanks to this drug company, and thanks to your Food and Drug Administration for a drug that's already been in the market for 50 years, is now $1,500. Meaning, going from a few $100s to prevent a premature birth, now went to an average treatment cost of $30,000. Their justification is a preemie baby is $51,000 to take care of, so $30,000 should be a good deal. And the mob used to call us extortion. Something to think about. A lot of the doctors said the exact same thing. For crying out loud, this is about making money, said Dr. Robert Snow, Deputy Director of the Massachusetts Medicaid Program. I've never seen anything as outrageous as this, said Dr. Arnold Cohen, an obstetrician at the Albert Einstein Medical Center in Philadelphia, and I'm breathless, said Dr. Joanne Armstrong, the head of women's health for Aetna, the Hartford-based national insurer. Yeah, they're going to have some low-income things for people that can't afford the medication, like most everybody, but you're going to end up paying for it one way or the other as a taxpayer. And basically, keep in mind, this drug was already in the market for 50 years. How did this company do this? Well, even though they didn't do one study on the medication, they promised to do studies on the medication to the FDA so they can get orphan drug status. Kind of like me saying I'm promising to do studies on water, so give me the patent on water or the exclusive rights of water for any medical use. Yeah, stupid, yes. Corrupt, no doubt about it. And to top it all off, they got the backing from the March of Dimes. In exchange, the March of Dimes got from this drug company hundreds of thousands of dollars in donations for their hard work convincing the FDA to give this company orphan drug status so they say it can produce a better quality medications. Not that there's very many problems reports or anything like that from any of the thousands of compounding pharmacies out there. So now they would, then on top of that, the drug company had the kindness to send cease and desist letters to all compounding pharmacies out there. Otherwise, they'll use their buddies at the FDA to lobby enforcement actions against them for making the drug. No more cheaper versions. Good example of government intervention to screw over the taxpayers. Now, another one. Now that you have your drug that was already in the market 50 years because you're not creative enough to make a new drug or better drug, the Supreme Court lets stand a ruling that drug companies can pay rivals to delay production of generic drugs without violating federal antitrust laws. Meaning, once I develop a drug, let's say for example, like this one, this progestin, I now can pay my competitors not to produce the drug indefinitely. Of course, they say delay production, but there's no time limit on delay production. How does this occur? Well, Bayer paid another company called Bar to prevent it from bringing to market a version of the antibiotic drug Cipro. The deal involving Bayer's 1997 settlement of patent litigation with Bar was challenged by a number of pharmacies, which appealed to the Supreme Court. More than 30 states and various consumer groups supported the appeal. Why not? It sounds like something criminal. But the FTC also opposed the deals, saying they violated antitrust laws and cost consumers an estimated $3.5 billion a year in higher prescription drug costs. The Supreme Court rejected the appeal by the pharmacies without any comment. This is groundbreaking because this means it's more than just having a monopoly. It means you can basically do anything you want, take a drug that's already in existence, patent it, get orphan drug use, and you will never see a competitor to that drug regardless of who paid for the research. Probably one of the most disturbing things to happen in a long time. Well, my time is running out, and I thank you for the intro. Thank you.
Thank you very much, Ralph. Once again, we appreciate you watching our show. Use this information to help yourself and help others. Have a great night. Bye.